If you're someone who's been dealing with high blood pressure, this is something you should pay close attention to. That sudden pounding in your head, the tightness in your chest, or that occasional dizziness you feel when you stand up too fast. These aren't random. They're your body's way of saying your blood pressure is running too high. High blood pressure, also known as hypertension, affects nearly 1 in 3 adults worldwide. And what's shocking is that many don't even know they have it until it's already caused damage. By the time symptoms show up, your heart, arteries, and kidneys may already be under serious strain. Studies show that untreated hypertension increases the risk of heart attack and stroke by more than 70%, and it's one of the leading causes of preventable deaths around the world. The good news is that lowering your blood pressure doesn't always require months of treatment or heavy medication. In fact, there are scientifically proven techniques that can bring your blood pressure down within just a few minutes, safely and naturally. These methods work by activating your body's built-in relaxation systems, improving blood flow, and balancing key hormones that control pressure in your arteries. You can do most of them right at home, without any special equipment. So before we go any further, I'd love to know, have you ever tried natural ways to lower your blood pressure quickly? Do you rely on medication, or have you experimented with breathing exercises, posture techniques, or natural remedies? Let us know in the comments. We read every one and often share personalized guidance to help you feel better, faster. Now let's go through the 6 science-backed techniques that can lower your blood pressure in as little as 5 minutes. Number 1, slow diaphragmatic coherent breathing. Slow diaphragmatic breathing means breathing with the belly, not the chest, at a steady, slow rate. The target used in many tests is 6 breaths per minute, roughly a 5-second inhale and a 5-second exhale. That pace increases the size of each breath and raises baroreflex sensitivity, which helps lower heart rate and reduce the force pushing blood through arteries for a short time. In controlled studies, single short bouts of structured, slow breathing produced measurable drops in systolic blood pressure. For example, a large multi-center analysis reported that a brief bout of structured deep breathing, 6 breaths over 30 seconds, lowered systolic pressure by about 3 to 4 millimeters of mercury and diastolic pressure by about 1 millimeter of mercury compared with rest. Longer practice and repeated sessions tend to give larger effects over days to weeks. How to do it and how to test it. Sit upright with your back supported, feet flat, and both feet on the floor. Rest 5 minutes before any baseline reading. Use an automatic cuff on the upper arm and take a baseline reading while you are still and relaxed. Then set a simple timer for 5 minutes and follow this pattern. Inhale through the nose for 5 seconds, feel the belly rise. Exhale through the nose or gently through the mouth for 5 seconds, feel the belly fall. Keep the chest still and the shoulders relaxed. If 5 seconds feels too long at first, use 4 seconds in, 6 seconds out. After 5 minutes, sit quietly for 30 to 60 seconds and then repeat the blood pressure reading in the same posture. That paired measure gives a clear before and after comparison. Repeat daily or twice daily if you want cumulative benefit. Practical users report immediate drops in readings and greater stability over weeks. Why it works, in plain terms. Slow, deep breathing increases variability in time between heartbeats, which is a sign of stronger parasympathetic calm control. That lowers the background drive that keeps blood vessels tight and the heart beating faster. Slower breathing also raises the sensitivity of baroreceptors, the sensors in the neck and chest that read pressure, so the body corrects pressure more efficiently. The net result is a short-term fall in both systolic and diastolic pressure in many people, and regular practice can shift baseline readings down over weeks. How big the change typically is. Expect modest but useful drops right away. Single short sessions commonly reduce systolic pressure by about 3 to 6 millimeters of mercury for many people. Repeated daily practice can add up to larger falls over time. The amount you get depends on current blood pressure, fitness, age, and whether you practice often. People with higher baseline pressure usually see larger absolute drops. Use the numbers above as a realistic range, not a guarantee. Safety and limits. This technique is low risk for most adults. Stop if you feel lightheaded or faint, if you have severe lung disease, recent eye or thoracic surgery, uncontrolled high blood pressure, or complex heart rhythm problems. Check with a clinician before trying strong-paced breathing. This method is an immediate self-help tool for spikes and stress. It is not a substitute for prescribed blood pressure medication or urgent medical care if readings are dangerously high, for example, above about 180 to 120 millimeters of mercury, or if you have chest pain, sudden breathlessness, or other alarm signs. Number 2, short guided mindfulness or focused attention meditation. A focused 5-minute meditation is a direct way to lower stress signals that raise blood pressure. The practice is very simple. Sit still, pick a single anchor, breath, a single word or a body sensation, and gently return your attention to that anchor whenever the mind wanders. Short guided recordings work well because they keep you on task. Clinical summaries show that even brief sessions raise parasympathetic tone, lower stress hormones, and lead to small immediate falls in blood pressure and heart rate. Repeated short sessions add up. Programs run for weeks show larger, sustained drops in resting blood pressure. Practical step by step. Sit upright with a relaxed jaw and loose shoulders. Set a 5-minute timer or play a 5-minute guided track. Close your eyes or keep a soft gaze. Take 3 normal breaths, then settle into natural breathing. Choose an anchor like in on the in-breath and out on the out-breath, or repeat a neutral word on each out-breath. When a thought grabs you, note it briefly, thinking, and return to the anchor. Keep the practice non-judgmental. Noticing distraction is part of the exercise. After 5 minutes, open your eyes, sit quietly for 30 to 60 seconds, and then take a blood pressure reading in the same posture you used before. That paired reading shows the immediate effect, how it changes the body. Focused attention cuts down the fight or flight response that lowers adrenaline-like signaling and calms the nervous system. Over minutes, this reduces heart rate and relaxes blood vessels. Over weeks, regular practice lowers baseline pressure in many people. Reported acute drops after short sessions vary, but most trials show small to moderate falls in systolic pressure and consistent reductions in heart rate variability markers that track calm state activation. Numbers to expect. Immediate drops are usually a few millimeters of mercury. In clinical programs lasting several weeks, larger reductions have been reported, often a decrease in both systolic and diastolic pressure by low single digits to around 5 millimeters of mercury, depending on the program length and participant group. The biggest advantages come when short sessions are repeated daily. Use the immediate drop as a quick fix and the daily habit as the path to steady change. Safety and boundaries. Meditation is safe for most people. It can make strong emotions surface in some users. If that happens, stop and try a shorter session or speak to an instructor. If your blood pressure is extremely high or you have acute chest pain, breathing difficulty, fainting, or other red flag symptoms, get medical help instead of trying to self-manage with meditation. These practices are supportive tools, not emergency treatments. Number 3, cold water facial immersion or splashing the face, triggering the dive reflex. Putting cold water on the face activates the mammalian dive reflex. That reflex slows the heart and redirects blood toward the core. In emergency care, the same vagal trigger is used to stop certain fast heart rhythms because it reliably drops heart rate. For blood pressure, the dive reflex often causes a quick slowing of the pulse and can lower arterial pressure for the short period after immersion, though results vary across people and protocols. The heart rate drop is the most consistent immediate effect. Changes in blood pressure are less uniform, but often present at least briefly. How to do it safely and simply. Sit or lie down, fill a bowl with cold water, Tap cold is fine. Clinical tests often used water around 10 to 15 degrees Celsius. Take a normal breath, bend forward, and dunk or splash the face for 10 to 30 seconds. Alternatively, soak a towel in cold water and hold it firmly against the cheeks and forehead for 20 to 30 seconds while breathing slowly. Avoid forceful breath holds unless trained. After the maneuver, sit quietly and check your pulse and blood pressure. Expect an immediate drop in heart rate. Blood pressure change may appear as a modest fall that returns toward baseline over minutes. Who should avoid it? Do not use cold face immersion if you have unstable heart disease, known dangerous slow heart rate conditions, recent heart attack, or certain rhythm devices without clinician approval. If you feel faint, dizzy, or unwell during the test, stop immediately and rest. For people with borderline blood pressure control or rhythm issues, ask a clinician before trying the dive reflex as a self-care tool. Number 4, progressive muscle relaxation and quick tension release routines. Progressive muscle relaxation uses tight and release cycles to drop body tension fast. The method is simple, but it works because tense muscles keep the nervous system in on mode. That keeps heart rate and blood pressure higher than they need to be. When you tense a group of muscles for 5 to 10 seconds and then let them go, the body notices the change. Heart rate slows, breathing calms, and blood vessels relax. In clinical tests, a standard PMR session produced an immediate fall in systolic pressure of about 5 millimeters of mercury and diastolic pressure of about 3 to 4 millimeters of mercury, with further small gains after repeated practice over days or weeks. That size of change is enough to matter in daily life. Even a 2 millimeter of mercury fall in population blood pressure lowers stroke and heart disease risk in meaningful ways. Start by getting into a steady seat or lying flat. Take one normal breath, then tighten the jaw and face for 5 seconds and release fully while breathing out. Move to the shoulders and neck. Shrug them up hard for 5 seconds, then drop them and notice how the weight falls. Tighten the hands into fists. Hold, release. Tighten the forearms, biceps, chest, belly, hips, thighs, calves, and feet in the same way. Hold each tense phase for 5 to 10 seconds and then relax for 10 to 20 seconds before moving on. In a strict 5-minute condensed version, cover 3 major zones: face and jaw, shoulders and neck, and legs. Tighten each zone for 5 seconds and then release and rest for 10. Finish with 1 minute of slow breathing and a short body scan to notice the difference. Do the whole cycle twice if you have time. The condensed approach still reduces sympathetic drive and gives a measurable short-term fall in blood pressure for many people. Measure correctly so you can judge the effect. Sit quietly for 5 minutes and take a resting reading with a validated upper arm cuff. Perform the 5-minute PMR routine while seated or lying down. Wait 30 to 60 seconds after you finish, then take the reading in the same posture. Repeat this paired test for several days to see your personal response. Track your numbers and note any patterns. Some people see an immediate drop each time, others only get a small change the first few times and more consistent drops after a week of practice. Recording these paired readings is the only reliable way to know if PMR is helping you. Use PMR when stress or muscle tightness is driving a spike. It is low risk for most adults and easy to do anywhere you can sit for 5 minutes. Avoid aggressive holds or jerky movements if you have recent musculoskeletal injury. Move gently if you have chronic pain and stop any move that increases pain. If you have serious heart disease or unstable blood pressure, tell your clinician before starting any new routine. PMR is not a substitute for medication or medical care when blood pressure is dangerously high. If you measure values above about 180 over 120 millimeters of mercury, seek urgent medical advice rather than relying on relaxation alone. To get the most from PMR, make it a short daily habit. Do one 5-minute session on waking and another before bed, or use it as a reset when work stress spikes. Combine PMR with slow diaphragmatic breathing to strengthen the immediate effect. Over a week, you will see whether the routine produces reliable falls in your readings. If you want bigger drops in steady, long-term blood pressure, pair PMR with daily movement and standard medical care. PMR gives a fast, safe way to remove tension and lower pressure in the moment. Keep records, be consistent, and check with your clinician when in doubt. Number 5, a focused 5-minute movement burst and recovery, post-exercise drop. A short burst of higher intensity movement can lower blood pressure for minutes to hours after you stop. This is called post-exercise hypotension. The effect appears reliably in people with high blood pressure and in many without it. The mechanism is straightforward. Exercise causes blood vessels to dilate and shifts central nervous system control, so the body holds a lower pressure after activity. The duration varies. A brief session can produce a measurable fall in systolic pressure that may last for several hours in some people, and repeated daily bursts add up into a lower average resting pressure over time. For public health, an average daily drop of just 5 millimeters of mercury in systolic blood pressure can cut heart disease deaths by a substantial percentage. Do this safely and practically. Warm up for 30 seconds with easy marching or arm swings. Push hard for 2 to 3 minutes with brisk stair steps, fast marching on the spot, or quick bike sprints where breathing is heavy but you can still talk in short phrases. Then cool down for 1 minute with slow walking and finish seated for 1 to 2 minutes of slow breathing. The whole cycle fits in 5 minutes and gives a powerful signal to your cardiovascular system. For many people, a single 5-minute burst produces a short-term fall in blood pressure. When repeated 2 to 3 times daily, it can shift day-long averages downward. The intensity matters. Moderate to high effort gives a stronger post-exercise drop than light movement, but don't push into danger. If you have heart disease, recent heart attack, or uncontrolled hypertension, get clearance first. Measure correctly to judge benefit. Take a baseline reading after 5 minutes seated, perform your 5-minute burst and cool down, then sit and measure again after 1 to 2 minutes of rest. Repeat this routine across several days and chart the before-after pairs. Expect variation. Some days show a clear fall of a few millimeters of mercury. Other days changes may be small. Men and women respond differently at times. Fitness level and the exact exercise mode also matter. Short, high-intensity bursts often deliver a larger immediate response than gentle walking, but the safest option is what your clinician signs off on. Use cool downs and monitor symptoms. A rapid fall in blood pressure after exercise can make you lightheaded if you stop too fast. Always include a brief cool down period and sit if you feel weak. If you notice regular fainting or troubling symptoms after short activity, stop and consult a clinician. For people on blood pressure pills, timed exercise may interact with medication effects. Logging your activity and readings helps your clinician adjust treatment safely. For long-term lowering of average pressure, regular short bursts plus steady cardio work over weeks is powerful and supported by research showing consistent reductions in resting systolic pressure with regular exercise. Make this a habit you can keep. Fit short bursts into daily life. Take 2 minutes on a stairwell between meetings, do a cycle sprint at home, or march hard while the kettle boils. Repeat once or twice more that day. The trick is regularity, not perfection. 5 minutes done 3 times daily beats a single long session once a week for blood pressure control. Track your numbers and symptoms, be cautious if you have known cardiac risk, and use this method as part of a broader plan that includes diet, sleep, and medical care. Number 6, extended exhalation techniques and humming, vocalized exhalation. Extended exhalation shifts the nervous system toward calm quickly. The pattern is simple. Inhale for a short count and exhale for a longer count. A common and effective rhythm is inhale for 4 counts and exhale for 6 to 8 counts. The longer exhale activates the vagus nerve and lowers heart rate and vessel tone. Adding a low hum during exhale, as done in Brahmari or bee breathing, gives an extra signal because the vibration in the throat stimulates sensory pathways that feed into the same calming circuits. Short sessions, 2 to 5 minutes, can increase parasympathetic markers and often reduce heart rate immediately. The blood pressure response varies across people, but many see a small fall right after practice. How to practice quietly and effectively. Sit upright with a loose jaw and relaxed shoulders. Breathe in comfortably for 4 counts through the nose. Purse the lips slightly if you prefer, then exhale for 6 to 8 counts while humming a soft sound that you can feel in the chest and throat. Keep the hum steady and not forced. If humming in public makes you self-conscious, use silent extended exhalation at the same timing without the vocal sound. You will still activate the vagal pathways and get benefit. Repeat this for 5 minutes and then sit quietly for 30 to 60 seconds before checking your blood pressure. Use paired readings across days to judge the effect on your numbers. Understand the mixed evidence. Many trials show improved parasympathetic tone and lower heart rate after humming or extended exhalation. Some studies report immediate falls in systolic and diastolic values, while a few found rises in certain measures like diastolic pressure during active humming in some people. The practical takeaway is this: humming and long exhale breathing are low-risk tools that reliably calm the nervous system, but the blood pressure response can vary individually. Measure carefully and watch how your body reacts. If a session raises your pressure or makes you dizzy, stop and try a gentler breathing pattern. Safety and daily use. These breathing methods are safe for most people. Do not force breath holds or strain. If you have severe lung disease, recent thoracic surgery, or unstable heart rhythm issues, check with your clinician first. Use extended exhale breathing as a quick reset in stressful moments,